All right. Well, next step is let's try and see if we can get through some of these fillings. So these we're going to try and get into some procedures where this will hopefully start to become a little bit more routine. You'll probably see more consistency with these fillings than you will with like a limited exam where it could just be almost anything. You don't know what we're going to do when they come in. I'm sure these videos are super exciting because I have a wonderful backdrop and it's probably boring. It's a good thing I'm not on a green screen where you can see the beach or something in the background because you probably wouldn't pay attention much. But here we go. So amalgam filling. The first thing we're going to try and do when everybody comes in for a routine procedure, filling, crown, that type of thing, is we're always going to make sure that the patient and you and the doctor are all on the same page. So the first thing that we're going to do when a patient sits down is usually I'll say, "So, Mrs. Mickey Mouse, we've got a filling planned on tooth number on your upper right side." And they say, "Oh, I thought we were doing the lower left side today." And then you can look at their treatment plan and see that there's some fillings down there. There might have been a mistake in who scheduled the treatment, but we're going to try and make sure that the patient, you, and the doctor are on the same page. So Mickey Mouse, looks like we're going to do that filling on the lower left side. Then that sounds good. And then the next thing you're going to try and do is make sure that you have all the needed x-rays for that tooth. And so if they say, "Oh, we're going to do the lower left side," and you realize, we don't have an x-ray, that's a great time to check with the doc to say, "Hey, we don't have an x-ray of this tooth. Do you want me to get this before we get him numb?" And I'll say, "Yeah." And then he'll tell you what type of x-ray to get. So we want to make sure that you confirm with the patient. And most of the time, I'd say 90% of the time, what's on the schedule will be what the patient wants. And so you can just go right into it. But we always want to double check because sometimes they might chip a filling or might do something between the time they were in and the time they came. And they may want to try and address something differently that day. So we're just going to re-verify that. And then anytime that we give anesthetic, we want to make sure that we have the blood pressure. And you can always just make sure too with them, we want to update their medical history and then take their blood pressure. So you can start putting the blood pressure cuff on their wrist and say, "Hey, Mickey Mouse, have you been to the hospital or changed any medications recently?" And if they say no, then we're most likely in good shape. So we can kind of keep it to those simple questions. Sometimes if you just ask, "Hey, has anything changed in your medical history?" they might be like, "I don't think so." But you can always just ask, "Have you ever been to the hospital or changed any medications?" So those are kind of the big ticket items that we probably need to make sure that we get a hold of. So then moving to anesthetic. First thing that we're going to try and do is we'll teach you how to place topical anesthetic where, like for which teeth, we like to put the anesthetic in this location. And so this is where we want to put numbing gel down on their gums. And at some point, we'll probably teach you how to do it. But for starters, just make sure the dentist puts it in the right spot. And then as you kind of get trained and kind of go through it more, you'll be able to place that topical. And we usually don't want to place it, too early. We only want it on there for like 30 seconds to a minute, maybe 2 minutes most, because it kicks in really fast. And so probably don't want to have it there too long. If you're going to be doing a filling on the bottom jaw, on the mandibular jaw, most likely they'll want a long needle. And that's usually yellow. So you can grab out a yellow needle. And then most likely, if it's going to be the upper, you're going to do a short needle, which is usually blue. And so when you get the numbing gel off, you'll put that down and you set up the syringe for the doc. You'll try and do a yellow if it's the lower and a blue if it's the upper. And then you'll get that syringe going. Usually you want to have a few different types of capsules out. At first, you'll want to try and make sure that you get either a lidocaine, which has got a red ring on it, or you can do septo, which is usually articaine, and that has a gray ring on it. So you can get both of those out. Most docs like to stick with just one type of anesthetic. I like to shake it up and do a lot of different things, and you'll kind of learn the doctors as you go. But it's not a bad idea to have both of them out just to make sure that they have what they need when they need it. So you don't have to go back and get something different. And then what is going to happen is once you take out the numbing gel, usually you like to have the patient close down the saliva ejector, which is what we call Mr. Thirsty, where it sucks out all the saliva. That way they don't have to swallow their saliva that has the numbing gel in, and it gets their throat kind of numb. So we don't want to try and do that. So as soon as we take that out, we want to have the saliva ejector ready to go so that you can just close around the patient. And then at that point, that's when the doc will go in and numb them up. Usually right after numbing too, you want that saliva ejector available. Give the patient just a little bit of water, rinse out, suck it out, because sometimes if they get any of the anesthetic in their mouth, the anesthetic is really bitter, and maybe you should try tasting it sometime so you know what it feels like. Anyway, once you got all the numbing stuff, then there's going to be about a 5 to 10 minute break while they wait to get numb. And this is a great time to make sure that everything is set up beforehand so that when the doc comes in, they're ready to go. Most of the time, you're going to have a 557 burr in the handpiece, and that is going to be in the high-speed handpiece, the one that's the one that's like Mr. Whistle is what we call for the kids. So you'll have that 557 in there. The other thing you'll have is in the slow-speed handpiece, you'll have a 4 round burr, which usually that's a latch head, and you'll be able to learn all this really quick. And then you'll have the restorative block available, which has some smaller ones, some pointier ones, just for like unique cases. Sometimes the doc will switch them out, and sometimes a doc likes to use a 330 burr or a different type of burr. But typically, that's where we're going to sit is in that arena right there. Once you've got the burrs in, the patient's numb, you're ready to go. You've got the exact plan of what we're going to do. You have the X-ray for the tooth. Typically, the doc, when they sit down to try and do the filling, they like to have the X-ray pulled up. Some like the X-ray pulled up, some like the chart pulled up to review it right before they start. So once again, kind of have that in mind with the doc, but you'll have that X-ray set up, and then you're going to do the cavity preparation. Preparation is you're going to prepare the tooth to receive the filling. So you'll use the high speed most likely first, which is the drill. So you'll start with that drill, and you'll clean it all out. You'll be using the high speed suction. The big Mr. Thirsty. Mr. Thirsty's grandpa is what I like to call it. So you'll have high-speed suction, and you'll have that right by the tooth that the dentist will be working on. You'll be reflecting either the tongue or the cheek to help keep everything out of the way so the dentist can use it. You'll be experts at using suction and using that to isolate the tooth that the dentist is working on. Sometimes the dentist likes to either have a cotton roll or a dry angle, especially if it's on an upper back tooth. A lot of people like to have a dry angle or something to keep the cheek out of the way so that when we're drilling, we don't drill on the cheek, which is not a good thing. But I would be dishonest if I told you I've never done that before. So that's why I like to use dry angles a lot. Then you'll just make sure that once the drilling is kind of completed, they'll use the high speed and you'll use the suction, and that the water in there usually cleans it out at the same time. But sometimes you'll like to air dry it. The dentist will like you to either rinse it or dry it while you're working. So you'll have the suction right by the tooth, you'll rinse it out, and then that way he can see what's going on. You always want to air dry it at the very end because that allows you to be able to see a lot more. Then you're going to make sure that you're ready to have the Explorer and the cavity preparation, ready to go so that they can see the area. So then you rinse it, you dry it, and then you'll hand them the Explorer. Most of the time the dentist will already have their mirror in their hand. That way you can have the Explorer and make sure that things are good shape. Then you'll have them and they'll check it and make sure everything's good. A lot of times if it's not all the way done, then they'll use the slow bumpy drill, which when they're doing the slow bumpy drill, sometimes they like to have the suction there to kind of reflect the tongue or the cheek, but you usually don't have to have it on during that time. The suction when it's on is really, really loud, and so sometimes if we can have it off, the more the better. But oftentimes as soon as they're done with the slow speed, the Mr. Bumpy one, they like to rinse it and dry it so that way they can get all the decay out and see where they're at. And then a lot of times you'll be handing back and forth the Explorer as the dentist checks just to make sure that everything is good and cleaned out. If you're going to be working on the top, sometimes the doctor is going to need help keeping the mirror clean. Once you have the mirror in there and you start the drill and water just goes everywhere, it covers the mirror and then the dentist can't really see what they're doing. So to make sure that it stays clear, the mirror stays clear, a lot of times you'll take the air water syringe and you'll constantly dry the tooth while the dentist is working, you'll dry the mirror while the dentist is working on it so that he can continue to see. So that's what that line is all about. Once the filling's done and everything's cleaned out and the dentist checks out the Explorer and he says, all right, I'm ready to go. This is the type of thing that you're going to want to have out if you're going to be doing an MO or an MOD. So, which MO, mesial occlusal, distal occlusal, mesial occlusal distal is what those stand for. And those are going to be the surfaces that are in between teeth. You'll use something called a Tafelmeyer band for an amalgam filling. And then you'll have a wedge that you'll pass to him with the cotton pliers. So you usually have the Tafelmeyer band set up. At first, you may not know how to set it up, and the dentist can do it. But once you've been doing it 2 or 3 times, we kind of expect you to make sure that you have the Tafelmeyer band set up and you know how to do that. You'll hand that to the dentist. Then you'll hand the wedge to the dentist with the cotton pliers, so that way he can grab it and put it in really easily. And then you'll ask the doc, hey, do you want a cotton roll or a dry angle? Sometimes they need it for an amalgam filling. Sometimes isolation and keeping saliva out of an amalgam is not as important. And so they might not need it if they're in quick fix, especially for a kid. But sometimes, most of the time, you'll have either a cotton roll or a dry angle to help keep saliva out of the preparation, out of the tooth area where the filling is going to go in. Then you're going to place microprime, which helps to kill all the bacteria in there and also make the tooth not very sensitive. And this you'll have with cotton plier and cotton pellet. You'll hand that to him. Then you'll start mixing the amalgam, and you'll shake it in the shaker. Once it's shaked, then you'll condense the amalgam in a carrier, and you'll hand that to the dentist, making sure that they have enough room to grab it and put it in. And then you'll take that from them and you'll hand them the condenser. Then they'll start packing the amalgam in there. Once that's packed in, then you'll be filling the amalgam carrier just in case they need more. Then you'll hand the amalgam carrier and the condenser, and you'll kind of go back and forth until the cavity's all full of that silver filling. And then once that's full, then you'll hand them either a round ball condenser or an anatomic condenser, and that just helps them to start shape it. Then you'll hand them the clay or discoid, so that way they can clean it off and carve it just right, get the occlusion a lot better. And then make sure that as they start cleaning it off, you'll see lots of flakes of amalgam start coming off. This is when you can use the HVAC, that big suction, and you can try and suck out a lot of the amalgam, maybe do a little bit of rinsing, but I would just it's technique sensitive with the dentist to make sure that they have what they need while you're doing it. Then after you're done and you take off the Toffemire and you take out the wedge, then you're going to check the occlusion to make sure that the bite is okay, that they didn't put too much filling in there or they didn't put too little filling in there, and that's usually done with the articulating paper, that blue paper. So you'll make sure that all those amalgam pieces are out, and then you'll check the occlusion with the articulating paper. Once that's done, make sure you're ready to hand the clear or discoid to the dentist, because they might want to change the occlusion. They might want to scrape a little bit more away. Once that's done, if it's an interproximal, so if the filling covers like the in-between surfaces of the teeth, then they may want to have floss to make sure that they can check in between there. Sometimes if the amalgam is really, really soft or the amalgam's light, they don't want to run floss through there because it'll open up the contact, but I would just make sure that you have floss ready to go for that. And then post-op instructions, one thing you really want to try and go over with them is you don't want to bite anything for 24 hours because it takes a whole day for that stuff to set up. Once that's set up, then they're good to go. And if they want to come back and have it polished, they can, because amalgam fillings, silver fillings, are kind of rough to start out with. They kind of get smoother with time, but you want to make sure that the patient knows that they might be a little bit more rough and they can come back to have it polished and they're not anything super hard for a while. And then whenever we do a filling, one thing that we always want to mention is, hey, it might be a little bit sensitive for a while because we're just did a surgery on your tooth, and it might just be a little cold sensitive for a week or two. And then you'll schedule them for their next treatment. One thing, again, that you always want to be mindful of is that as soon as you lean up that patient, they're going to want to run out of there as fast as they can. The dentist wants to leave, the assistant wants to leave, the patient wants to leave, and they just want to get up and run. We want to make sure that when they sit up, you'll hear the doc say something like, all right, well, we're going to let this patient experience specialist take over, and they're going to get everything in the computer, and then they'll let you out of here. And this is a time for you to make sure that they have an appointment for their next cleaning, their next filling, or whatever needs to be done. A patient should always have a returning appointment. There should always be something for them to come back for, if nothing else, just to make sure that their teeth are cleaned. So you'll just confirm with the dentist, this is what we're doing next, right? And they'll be like, yep. And then you can jump in and help schedule them and get them ready to go as they sit up and kind of let the blood rush out of their head and make sure they're good to go. Anyway, other than that, that's how an amalgam filling usually typically goes.